Let's take an example look at how doctors stage cancer. We'll pretend we have people who are as see-through as glass, and we can simply observe what's going on inside. Now remember, I'm not a doctor, neither are you. These examples I've simplified. I don't even have the organs in the correct place. Let's suppose our gentleman comes in complaining of pain in the back, and he's had some bloody urine and such. So we scan him, and we find this nice egg kind of tumor sitting in the liver. Well, this is easily operated on because the liver regenerates. It's nice smooth margins, so it's probably not malignant. But we're concerned because the liver is rarely the place where cancer starts. So further investigation turns up that he's occasionally spitting up blood when he hiccups and has some breathing difficulty. Now we have a problem. The scans inside the lung reveal large tumor masses that have tunneled into the wall of the lung so effectively they've actually gone right through it to the inside, and this is why he's spitting up blood. So this is very bad. This may be where the tumor started. So we do some further scanning to find that it's growing and spreading through the body like a tree or an octopus and has in fact attached itself to the spine. And we see the bone being eroded on the spine, which would explain his back pain, numbness in the legs, and even having a bit of incontinence problems. So we swivel around and take a look at the back of the person in its entirety, and there we notice the spine is being damaged as the malignancies tunnel into it and the vertebrae begin to collapse. This is extremely painful, and there's not much we can do there. So the center chest tumor is largely inoperable. But then the worst news comes when a spinal tap is done, and scanning the spinal fluid we find blood in it. Well, the only way blood could get in the spinal fluid is if there's a leak. And as they investigate, sure enough, tumor metastases start to show up, meaning the tumor cells have dug right through the backbone into the spinal canal and are now freely moving up the spinal fluid, which means they'll wind up in the brain. This has gone from what looks like a promising, simple removal of the tumor in the liver to find out the person is riddled with it everywhere. There's really not a lot that can be done in this situation. So let's take a look at our possible options. The primary tumor that was found in the liver could be surgically removed or hit with radiation. The liver is a major organ that actually regenerates itself, so cutting it out is probably the easiest thing to do, and the liver will regrow. However, the tumor in the center of the chest is inoperable. It's sitting smack between the lungs and the heart. It's attached itself to everything, and a beam of radiation is going to hit everything in its path, damage the heart and the lungs. The real problem is in the spread of cancer into the spinal column and elsewhere. It's clearly traveled from the lung to the liver already. So the cancer is out throughout the body. There's no place to really hit with radiation or surgery to stop it. So the only choice will be to use chemotherapy. Very often chemotherapy is started anyway, assuming this may have already happened. But here it's very late, and chemotherapy might stop it at this point. This leaves one thing left: the damage to the spine. Here, radiation can be used not to stop the cancer. They may decide to blast you with x-rays there because for some reason, high dosage of x-rays sometimes alleviates pain. And a person can be given x-rays not to treat the cancer, but for what we call palliative purposes, to make you feel better if the prognosis is grim. Remember, this is just a simple introduction. Don't take these treatments literally. I just wanted to give you an idea of how they stage cancer.